Thank you very much, Dylan, for taking the time and joining me on the show today. Really appreciate it and looking forward to a great conversation. You are a CEO and founder of a company called Mindbloom, working in the psychedelic space, something that transparently, I haven't spent much time, outside of this conversation really talking with others about. So looking forward to getting the full download. I think the best place to get started for those who don't know you, those who don't know Mindbloom, would be to sort of tell the story from as early as you're willing to go as to, how you've become an entrepreneur and how you came to do Mindbloom.
Yeah, thanks for having me on, Jake. I'm super fired up to chat with you today. In terms of where this all came from, uh, I grew up in a working class family in Southern California that was just annihilated by mental illness. So mental illness is widely considered the number one public healthcare crisis in the developed world. And that was pre-COVID, and it's been exacerbated by COVID. And that was something I saw at least firsthand in my home. Um, my mother is severely mentally ill, and we tried our best to help her. But being, part of the Americans who are, 70% of Americans who live paycheck to paycheck, we didn't feel like we had the resources or know-how. And ultimately, we lost her to her mental illness. And today, she's one of the 500,000 homeless people in the U.S. Um, Through that experience, one of the things that I saw is that when people have a mental illness or issue, it doesn't just affect them, which is really tragic as well, but it affects their friends, their family, their community, and the work that they're able to go on and do in the world. Um, when I graduated from college, throughout my journey, started to see that I was really achievement oriented, and whether it's a result of my upbringing or just happenstance, was really really focused on getting ahead, but had let a lot of my relationships with other people and relationships with the world really atrophy, and had like a really broken relationship with how I viewed humanity. When I was about 20 years old, I discovered positive psychology and really quickly came to learn that I was like deeply unhappy, and had a friend who really pushed me to try MDMA. At the time, I was very, very terrified and against trying any sort of illegal, drug, because I grew up with an addict in my home, and it was horrifying. But I knew that something at the time needed to change, and I needed to take some sort of drastic step because I felt really stuck with where I was at and who I was at the time. And so I tried it. You hear the story a lot with people who, are stuck somewhere, or are sort of stuck in their development and try a psychedelic for the first time. But it fundamentally catalyzed this massive journey for me. And, really in just the first sort of a session with MDMA, changed how I related to others in the world. So sort of blew open my heart for the first time and helped transform me from a pessimist into an optimist, someone who related well to strangers and other people, and really humanity as a whole. Uh, Over the past 12 years, psychedelic medicine has been this really pivotal and powerful practice that I've had for my emotional, cognitive, consciousness expansion and development. And through that time, rather than being an investment banker or management consultant, which a lot of people who graduate from where I did, the Wharton School of Business, end up going into, I built what I consider like very like world positive technology companies. So my first company was a platform to help connect really engaged voters with local political candidates, really trying to increase access to democracy. I was acquired by a company called Democracy. And my last company, Mighty, I was a platform helping people get a better deal from the justice system and helping to increase access to finance for people who've been injured in car accidents and construction accidents and medical accidents. Throughout that time, quietly, psychedelic medicine had been this big driving force of my development, helping me to become a better person for myself, but also a better person for my friends, my family, and the work I was doing in the world. And psychedelic medicine had been this thing that was the number one change I wanted to see in the world, seeing broader acceptance and access to it. So a couple of years ago, when I learned about ketamine therapy, that it was this available, prescribable psychedelic medication that was getting people these incredible clinical results, I became a clinical patient myself, had just as transformational of an outcome or benefit as I had on a bunch of other medicines, and saw clear as day that there's this opportunity to create this change I wanted to see in the world, to create a platform that's helping to radically increase access to these treatments by making them more approachable, affordable, and available for people, and partner with some of the top researchers and clinicians in the space to build programs and protocols and a platform to help people get even better clinical outcomes and experiences from those. And so that takes us to today, where we've built Mindbloom into this, sort of 100-person clinical platform. We have treated thousands of people and become one of the leading providers of psychedelic therapy in the world, and are getting people far outsized clinical outcomes for depression and anxiety and the future other mental health care indications and mood disorders than both the average provider and especially legacy treatments like Prozac and Lexapro.
Yeah, that's quite a story, and I appreciate you sharing it and being so transparent about everything, especially coming from sort of your experience growing up with your mother to now trying to seemingly sort of help people who have issues with mental health through this very new. My understanding is basically because the laws have changed, this very new solution of ketamine therapy and the science, supporting the laws changing, I suppose.
Yeah.
If we can rewind back a little bit to your first psychedelic experience, and eventually I'd like to hear sort of how sort of the recreational experiences compare to the sort of stuff that you're dealing with now. But what was that like, if you can recall, for people who are just sort of unfamiliar and they've never really had any sort of psychedelic experience? You mentioned how you sort of went in with like sort of a poor relationship with the world around you and came out as generally more of an optimist. Was it truly like a one event thing, or just sort of self-medicating for a little while you were able to figure out how to use these like pretty impactful drugs, I would say, to turn yourself around a little bit?
Hmm. There are a few directions to go in here, Jake. One is I should probably open up with the disclaimer that I'm not a doctor, not a researcher, but I am a psychedelic believer. I am a ketamine therapy patient in a clinical setting, and I am a tech entrepreneur and healthcare entrepreneur. So I can speak about my experiences and what I know, but not give any medical advice.
Yes, always good to get the disclaimers out of the way.
Um, so in terms of what the first experience was like, this is the classic, will you please describe an indescribable experience to me question, which is really fun to grapple with. One of the hallmark of psychedelic experiences is that they're ineffable or can't really be described with like the language that we have. That's what I'm up for the challenge to try anyways. So I think it's helpful to maybe frame what some different psychedelics that people might have heard about or know about are like, and how they're distinct from each other. And then I can go into MDMA, which is the first psychedelic medicine that I used, which to me has still been the most transformational one, that I've encountered for my personal growth and development and healing. So there are the classical psychedelics that most people think of when they think of a psychedelic. So this is LSD or psilocybin mushrooms, and they can have a variety of cognitive and emotional effects. But one way to think about it is they really extort, or they really distort your senses, your visual senses, your auditory senses, even your cognitive senses, to the point of really extreme distortion. And that's why when you see, sort of visuals and media or film, even if they don't really usually get it right, you sort of see these, patterns and waves and colors and distortions. Then there are psychedelics that work a little bit more in the background. So, for example, ayahuasca, which is derived from DMT and this MAOI, when ingested, creates subjective effects that can seem a lot like those classical psychedelics of LSD and psilocybin mushrooms, and can also be considered a classical psychedelic. but can act a little bit more in the background and have visions come up. Things can feel a little bit more dreamlike, and be a little bit more like deeper, maybe in the psyche than people are used to with the other ones. And then you have ketamine, which is what Mindbloom's affiliated providers prescribe through our platform. And that works even more on the background. So whereas these other medicines work on your serotonin system, sort of potentiating it, ketamine works on your glutamate system, which is the most common neurotransmitter in your brain, and actually is an antagonist and sort of cuts that system off. And as a result, people can have these out-of-body effects, can feel very trance and dreamlike. The visions can be more shapes and forms and memories, and very in the background of sensation. MDMA is its own really also unique psychedelic, and that was the one that I experienced first. Some people call it an empathogen or an entactogen because it really enhances senses of empathy and touch. For me, I, on say like a personality scale, will generally tend towards having low emotionality and high sort of cognition. So I like perceive the world through my thoughts and less so through my physical emotions, which I learned years after MDMA, but it all sort of fell in place and made sense. And so for me, a lot of my relationships with people are through how I think about them and less how I feel about them. With MDMA, it can feel like this massive, heart-opening and pathogenic experience where your heart feels like it's blown open. In addition to some of the physical positive effects, and for a lot of people say with like PTSD, it's really beneficial to get them into an uplifted emotional state where they can engage with and work with their trauma. For me, it just put me into this state of connectedness with complete strangers, other people, humanity at large, that even after the MDMA experience, both stuck with me in terms of where my baseline connection with others in the world was, but also showed me this vision of how I could feel more connected to people. And that for me catalyzed, this journey of really working on my emotional development and growth, which I think was quite stunted at the time, and working on how can I be a better person for others and have more EQ and social intelligence and empathy and compassion. And it's been a long journey, but I wouldn't be who I am or where I am today, and wouldn't treat people like I do today or work on the things I do today if it wasn't for that first catalyzing experience that both like raised my baseline and showed me what was possible.
Right. And so you talk about this journey as well as this initial sort of catalyzing event that may have, I don't know how it actually came to be that you tried it for the first time, but it sounded like a buddy sort of had recommended or asked you to try it with him or whatever it was. But sort of that by chance first moment, which sort of opened up this longer journey, which is now taking you through, I imagine, like a number of different sort of periods within it, and ultimately sounds like more recently you got into trying, becoming a patient of ketamine, and now your company is focused on ketamine. Can you sort of connect the dots a little bit in terms of like how did you get from that first eye-opening experience to where now you've probably tried a good number of things and sort of maybe you were able to better calibrate like how you went from maybe self-medicating without too much of an idea of what to do to a place now where I would think sort of feel a little bit more familiar and experienced with how to operate with these things?
Yeah, it's actually a pretty funny story, Jake. When I first discovered psychedelics, I did not know that there was such a thing as psychedelic medicine or psychedelic therapy. I thought I was just doing psychedelics. And I thought that I discovered this secret that they were good for me, that they were making me a better person for me and also making me a better person for others. And throughout the last 12 plus years of using a variety of these medicines very intentionally, I started seeing that they were also good for other people. I saw hundreds of lives transformed. And again, people becoming better for themselves, but also better for the world. It wasn't until maybe a handful of years ago, it's called halfway through my psychedelic life cycle or journey, that I discovered that this wasn't a secret that I had found. That there was this underlying truth here, where going all the way back to, I believe, the 50s, people were using psychedelics and researching how psychedelics could be used to help people with mental illnesses and help people progress personally, emotionally, psychologically, ontologically, and that there was no secret here at all. And even some of the practices that I had thought I discovered, like journaling after the experience, setting intentions. I didn't even know that word at the time, but setting intentions going into the experience about what I wanted to explore or uncover or work on, or how I wanted to get unstuck, or how I wanted to change, were established practices that other people were doing. When I discovered that, I didn't know like when or even if psychedelics would become mainstream, become something that were available for people to access. But I knew at that point, without a shadow of a doubt, that there was this underlying truth here that these could really help people and help the world. And at that point, it became the change I most wanted to see in the world, for the rest of my adult life, which is broader acceptance and access to these medicines and how to help people get the most out of them. So throughout my journey building other companies, I never thought that I would be able to be in a position where I could sort of be in the center of my ikigai, doing the thing I'm really good at, the thing I love, the thing that's a vocation that earns compensation, and the thing that the world needs with psychedelics. But I knew that that was something I wanted to find. And following along with the research, and both the clinical research, the scientific research, the progress pushed forward by scientists and thought leaders and authors and influencers like Tim Ferriss and Michael Pollan, it started to become clear to me that there was an inevitability happening here, that the truth was going to get out. So that was a big impetus for me. And I began exploring any way possible that I could contribute my talents to helping more people access these and getting the most out of them, when I learned about ketamine therapy from my doctor, and became a patient myself, and saw that there was an opportunity to build a telemedicine platform to increase access and get people better outcomes.
Right. So you talked about ketamine, and before you'd mentioned, hopefully I can sort of marry these two concepts. You mentioned how you had sort of organically discovered a couple of like practices that turn out like the research supports, when you had sort of found that you actually hadn't discovered a lot of this, that like this was existing and you had stumbled upon sort of this, known wisdom in a sense. So you mentioned like setting intentions ahead of the experience, journaling after it, whether it's in sort of the context of what you're doing now with ketamine therapy or more generally in terms of psychedelic experiences. Would love to hear sort of how those practices fit into things, what those are about, and how they sort of benefit the overall experience. And if there's anything else related to the experience that's crucial, just understanding, it's not just like taking the pill or whatever it is. There's a lot that goes into it that can make your experience better or worse, it sounds like.
Yeah, I think you just hit the nail on the head, Jake. There are essentially three periods of time where what you do around the experience can dramatically affect, the pleasantness of the experience, the quality of the experience, and the outcomes that one would get from the experience. There's the preparation, so what you do beforehand, the navigation, what you do, when you're under the effects of the psychedelic, and there's integration, so what you do afterwards. With preparation, two of the big components are essentially your mindset and the physical setting that you're in. So are you going in with a positive, expansive, open mindset, like well prepared for what the experiences, might happen, and not feeling, terrified or nervous or anxious about it? Although, yeah, that can also come up. And with the physical setting, are you in a safe, comfortable setting where you're not likely to be interrupted by something that's jarring or distracting or potentially dangerous, especially when you're in this really heightened perceptual state? Some of the practices to help people create those positive mindsets might be writing out intentions. So writing out things that people want to do or explore or solve, things that are holding them back, things they want to uncover. And that can help people both like anchor the experience so that there's somewhere to come back to during it, as well as prime the subconscious, similar to what people might do journaling an intention or a thought before going to bed at night. During the experience, there's like a skill level or a skill to navigating a psychedelic experience. One thing that we've seen is people who have a mindfulness practice are often a little bit more skilled naturally, or have built those skills to navigate an altered state. One of the things that our team talks to people about and teaches people how to do is follow this mantra of trust, let go, and be open. If you go in like really trusting that you're in good hands, the medicine's safe, that you'll get something out of it, that can be really powerful for people to come back to. Letting go as things come up. So, people often will have expectations coming to experience of what they need to get out of it or want to get out of it, or I thought it was going to be like this, or I don't want this to happen. And that can cause ruminations during the experience. So being able to let go and just passively observe and sort of be along for the ride without grasping can be really powerful for people during. And the last is to be open, trust, let go, and be open. And so that's, to make sure to help people think through the experience that they, don't need to get a specific outcome and aren't going to fight the things that come up because it makes them uncomfortable or it's not what they, hoped. Some uncomfortable truths or thoughts or visuals can come up during psychedelic experiences that can be really confusing, disorienting, or uncomfortable for people. And remembering to just be open and get curious about what's coming up can be really powerful. And there are a lot of other, sort of tips to navigate the experience. You can, try to, really be mindful and meditate during the experience, or listen to the music that's playing, which is something Mindbloom provides, like from your heart versus from your head, to try to, really be absorbed in it. But that's a critical component of the experience, is what you do during it. And then the third piece is integrating the experience. And so that there's sort of three buckets to how to take a psychedelic experience and turn it into a lasting benefit. The first piece of it is to capture the experience. And this is how we think about it. People think about integration a lot of different ways, but we find this to be an effective sort of a categorization for people to think through it. So the first is capturing the experience. With ketamine therapy, which is what Mindbloom's affiliated providers prescribe and oversee, the experience can be a little bit like a dream. And similar to a dream, if you write down what happens right after a dream, it's more likely to solidify and crystallize. And if you don't, it could like slip through your fingers. Ketamine acts on the glutamate system, which actually modulates memory itself. And so it can be a little wonky on the memory sometimes. By journaling immediately after an experience, whatever comes up, whatever came up during the experience, however it's making you, whatever it's making you think about now, it can be like grasping a thread of yarn and then coalescing that thread into a tangible, concrete ball of yarn that will then like stick, that you can both come back to and explore, but also, won't just drift away. After capturing the experience, the next big piece of integration is making sense of the experience. And so there are a lot of ways to help somebody interpret what happens during experience. At Mindbloom, we give people content from videos to audio to written to help them think about how to categorize experiences and explore what might have come up. We also match people to psychedelic guides who are trained at helping people talk through the experiences, both one-on-one and also in a group format. So one really powerful integration practice is getting together with a group of other people who have gone through, a similar but very different experience, and sharing what people's experiences were like and asking each other questions. It'd be really powerful. It's something we actually do, at Mindbloom internally for the team as well. Once somebody feels like they have taken these experiences and over the coming weeks made sense of them and interpreted them and understand like what came up and what it meant for them, the third step of integration is to actually action the experience. And so that's to leverage this neuroplastic state that's created from the psychedelic experience, from ketamine or psilocybin or LSD or ayahuasca, to actually create changes in your life. So you've had this, emotional change from the medication. You have had this cognitive insight into, what changes you might want to make in your life, or ways you want to be different, things you want to, habits you want to create, or bad habits you want to break. The next step is leveraging that neuroplastic state to actually make those changes and get them to stick into healthier neural pathways and actual behaviors and emotional patterns. So that's one way to break down sort of what goes into a psychedelic therapy experience that isn't just taking the medication, but preparing, navigating it well, and integrating it in order to get the most out of it. But the rabbit hole goes super deep, and different practices work for different people. So what's important is for people to figure out what works for them and to work with trained facilitators and clinicians to figure out what works for them and give them the tools to explore.
Yeah, that's a super helpful overview. I feel like you mentioned how it's sort of a rabbit hole. I feel like psychedelics are like the ultimate rabbit hole that may have, I don't know where that word comes from or where the phrase comes from, but it would seem that it could come from there. You mentioned how, after the fact, the importance of sort of capturing the experience and basically doing like a debrief. I think if I were to sum up everything that you said in like overly simplistic terms probably, but whether that's on your own through journaling or with others through conversation, that seems to be a part of the process. And you also mentioned sort of the I think both on the back end and on the front end of the experience, the sort of idea of thinking about how you might want to change, like what you might want to focus on for the purpose of change. Like change was a word I heard a couple of times, and it brings to mind this quote, probably like, I mean, one of few maybe quotes that I know related to psychedelics, but a quote that I've just thought about for a long time that has driven some of my intrigue, I guess, in the space in general, which is from Steve Jobs. He talked about how he's pretty well known to have like dabbled at least a fair bit with LSD, and talked about, there's this quote, I don't know what it was like verbatim, but basically he was like, you sort of see this other side of the coin, and you don't know exactly, once you're sort of out of the experience, you can't exactly replicate it or talk about what it's like or whatever, but once you've seen it, you sort of know it's there and you can't like unsee it. So one of the things I'm curious about as it relates to psychedelics is, um, do you see, I'm not sure how exactly to ask the right question here, but like, I'm curious if people have, you obviously are dealing with like a lot of potential patients and then people who end up becoming patients. And I'm curious if people have reservations about the change itself. Like change is something that I think people, obviously change is necessary for improvement, but a lot of people naturally are just scared of change. It's sort of this thing that brings people outside of their comfort zone, just by definition. And I'm curious how, um, any comments you have on that, basically, like if people, how you sort of help people overcome this concept that change is, maybe not good, and how you think about just this overall process and sort of acceptance of change, if that makes sense at all.
Yeah, I think it's a really good question, Jake. I mean, on the Steve Jobs thing, I think one of his quotes was also that taking LSD was one of the top three most meaningful experiences. And there's this, I think, hallmark study on psilocybin where they surveyed people who had taken it, and I believe it was 80% of people said that it was one of the top five most meaningful experiences of their life. But you ask a really critical question, which is if somebody doesn't want to change, how do you talk to them or convince them, or should they even explore changing? Um, Again, I'm not a clinician, but I mean, my philosophy or viewpoint is it's already like near impossible. Not near impossible. It's very, very, very challenging to change yourself. Like how often do you try to change something about yourself and fail?
Yeah, I mean, I think a lot of people do this all the time.
I mean, it's a struggle, right? Like a tiny percentage of the changes I want to make on a day-to-day, week-to-week, monthly basis actually sort of squirt through the other end. And I'm like very, very deliberate about it. Um, and so if it's hard enough to change yourself, it's like near impossible to change somebody else. So you can give somebody a, I guess if they're open to it, a transformational or like a catalyst medicine, like psychedelic medicines. But I think until someone's like ready to make a change, until they've felt that pain and want to make the change, I think trying to tell them they need to make the change is pretty hard. I guess there's interventions, right? Where maybe people don't understand how much a problem is affecting their friends and family. Like the proverbial frog has been boiled, where things have gotten slowly a little worse, a little worse, a little worse. And the frog in the pot doesn't realize they're being boiled.
Hmm.
But overall, at least with, say, Mindbloom's clients, the people we're helping have wanted to make a change for often 5, 10, 20, 40 years. Like Mindbloom's average client is 40 years old. So a lot of people look at us and say, you're a consumer brand. I assume your clients are, millennials or even Zoomers, Gen Z. But in reality, a lot of people have grappled with mental health care issues for a long time. So for instance, 50% of Americans will have a diagnosable mental illness in their lifetime. And that doesn't include all the people who won't go out and get diagnosed with one. There are 40 million Americans today, or about 1 in 8, who are on SSRIs or antidepressants like Prozac or Lexapro. And these medications can have terrible side effects like insomnia and weight gain, sexual dysfunction, sometimes suicidality. Very few people on SSRIs want to continue to be on SSRIs if they have the option. And so for a lot of people who have had a ruminative thought disorder, mood disorder, like depression, anxiety, eating disorders, social anxiety disorders, OCD, PTSD, alcohol use disorder, substance use disorder, have usually like struggled with this problem for a long time, 5, 10, sometimes 20, 40 years. And so I think for a lot of people, those are the people where psychedelic therapy and medicine are, you know, either best suited for or are the most attractive or interesting to. Um, and just anecdotally, in Mindbloom's platform, we see most of our clients have never done psychedelics before, never done ketamine therapy before. And for a lot of them, it's something they never thought that they would have considered, 5 years ago. But they've been in excruciating pain. They've tried, every other solution out there, oftentimes multiple times, and maybe failed with it, or it hasn't gotten the results that they were hoping for, looking for. And at this point, they've heard about psychedelics in surround sound from Oprah or NPR, or Tim Ferriss, or How to Change Your Mind, and they just know that they need to take a step to try to create some change.
Right. And so it must be some, pretty rewarding to sort of have these patients or I don't know, do you refer to them as patients or sort of like consumers? Either way, sort of having these people who, tell you it's their first experience and then, hopefully seeing positive outcomes from those experiences that you're facilitating. You've talked a lot about the importance of increasing access. What are like the actual issues with access? I understand a piece of it is cost, and you guys are working to, decrease that by, it seems like almost a degree of magnitude, like a, 10% cost type of thing, in like the, minimum viable product sort of situations where they can do add-ons and it gets more expensive and things like this. But can you talk a little bit about the access issue that that you're aiming to solve and sort of the nature of why it's not easily accessible already?
Hmm. Yeah, our big mission is to transform lives, to transform the world. The idea being that, born from my experiences, I saw that my mother being mentally ill didn't just affect her, which is tragic, but it affected our friends, our family, and she was really smart and has not contributing sort of work that she could do in the world and her contributions. And similarly, on the other side of the coin, I saw that psychedelic medicine helped me become a better person, both for myself, but also for others in the world. Our approach is to radically increase access to treatment, starting with ketamine therapy, and to do all that while also getting people superior clinical outcomes and just build magical experiences for people. When it comes to access, I think about three prongs. The obvious one, as you pointed out, is making it more affordable for people. A couple of years ago when I started Mindbloom, ketamine therapy was between $600 and $1,200 a session. Saw some providers go all the way up to $2,000 a session. Growing up with a single working class father, even if that medicine, ketamine, was available to us at the time, like the idea of spending $1,000 a session for something that felt new and different for my mother is so far out of the ballpark. It's downright hilarious. So one of the things we've been able to do at Mindbloom is to bring the cost down like 70 to 80%, so that it's closer to $125 to $200 per session, depending on the program and protocol for people. We also get some people reimbursed through out-of-network insurance and have long-term strategic initiative and priority to try to get this reimbursed in-network by insurance to continue bringing the cost down. But even so, today we've got it to be cheaper than like a year of talk therapy in network with insurance. The other two axes for access that we think a lot about are making it more available to people. So a lot of people just don't have access to a ketamine therapy provider. If you're a single mother of 4 living like 2 hours outside of Wichita, Kansas, who are you going to get to watch your kids and then drive you 2 hours, sit with you a couple hours, drive you 2 hours back for every single treatment? It's just not feasible. So by building a telemedicine product, we've already within a little over a year been able to bring this to 50% of Americans with depression and anxiety in about 14 states. Will reach over 75% of the US population by the end of the year. And that includes a lot of people who just previously wouldn't have access to these transformational medicines without it. The third, and I think maybe least sort of talked about access for increasing access to treatment, is making treatment more approachable. So similarly, if you had told my family 20 years ago that we would use a psychedelic drug to fight my mother's other drug addictions, that also sounds wild and probably something we wouldn't have considered. And so part of bringing access to people is also getting people to consider this a legitimate traditional medicine that's backed by clinical research, clinical studies, clinical data, and is getting people these transformational results. So today we're doing that through building a really friendly, approachable consumer brand that speaks to people and meets them at their level and is for everybody. And continuing to put out more and more of our client stories, of our clinical outcomes data. We're designing right now a clinical study that could be one of the biggest studies in psychedelic medicine history with our patient population, and really helping to craft the conversation around psychedelics and educate people strategically and intelligently to open this up for people to consider. So those are a few ways I think about access, but that is the name of the game when you have a treatment that's already getting people significantly better clinical outcomes than all of the other options currently available.
Yeah, I like the terminology that you're using. Different axes for access. It works. It sounds good and it works nicely. So one question, going off of the second point that you made on just like physical access for the mom who lives a couple of hours outside of Wichita, who you're now able to reach through telemedicine. Can you talk a bit about, like, my understanding was that prior to COVID, you guys, at least the first step was, and maybe I'm wrong here, but you were doing you were providing these services and these sessions in person. I think in a location in New York was the first one. And then I'm assuming, COVID sort of, whether telemedicine was in your roadmap or not. And I know that the legal situation around telemedicine changed a lot to make things that weren't previously possible post COVID. But how did that sort of transition change sort of it sounds like it would have improved your ability to sort of provide access along that second dimension. And how did you sort of take that situation just as as a CEO and realize like, hey, people aren't coming to the office anymore. but we have this huge opportunity here to bring everything virtual. And how does that sort of changed the company roadmap, like the way that you facilitate these experiences? Is there anything that's sort of been a trade-off where it was like a lot easier to do this certain thing in person and it's harder online, or maybe benefits vice versa? Curious to hear about sort of that transition to primarily telemedicine.
I work with this phenomenal personalized medicine physician in New York, Dr. Andrew Kibbert. And we do the whole biohacking thing, top to bottom. And uh, the way that I learned about ketamine therapy, despite donating to psychedelic research and considering myself in the 99.99th percentile of having my finger to the pulse of the future of psychedelic medicine, was from him. Uh, I was telling him that I wanted to start a company in mental health care and telemedicine, and I kept coming back to psychedelic medicine as the thing that's most impacted my life, the area where I thought the future was already here, just not evenly distributed. And with all the research, it was going to be the future, but probably a couple of years too early. MDMA at the time wasn't going to be FDA approved for probably 4 or 5 more years, probably 2 years away right now. He blew my mind when he told me that he had been prescribing ketamine in his practice. There's this growing body of research and growing small industry of ketamine clinics and providers that were getting people these phenomenal outcomes, and that he's had seen the same thing in his practice. So I became a ketamine therapy patient myself. And one of the big aha moments was it arrived on my doorstep. So I got a box of ketamine from a local pharmacy. And I called him and said, I think there's a mistake. This just arrived on my doorstep. And he let me know that it wasn't, that, he prescribed it in person to me, and that, this medication can be mailed and delivered. At that point, I saw clear as day that it was a matter of when, not if, we would be increasing access to this medicine using at-home and remote treatments. The more I started talking to psychiatrists and therapists and researching, the more I learned that there were already a lot of trailblazing psychiatrists and providers who were prescribing at-home ketamine therapy to their clients who were great fits for it. So what we did was launch a pilot facility in Manhattan. We actually did it for $60K in 60 days, and use that as a way to test a hybrid in-person remote at-home model to see, one, do patients want to do it? 2, do they get great outcomes? Are the outcomes worse? 3, are there any adverse events? And for the first 6 months, sort of in a private, call it not beta because it's a fully baked clinical product that we spent over a year developing, but for 6 months in sort of private launch under the radar, mostly through word of mouth. Our partner providers saw hundreds of patients. People love the at-home treatment. They wanted to continue the at-home treatment. There were 0 adverse events or outcomes, and the clinical outcomes that we were getting them based on established depression, anxiety scales were better than the average provider that just does it in person. When COVID happened, that just, that was a sign, or it was an opportunity for us to accelerate fully virtual treatment and really meet people where they were, forced to be during the pandemic, which was at home. And so over the last year, Mindbloom's become, one of the largest, if not the largest provider of legal psychedelic therapy in the U.S. Has helped thousands of people, is generating clinical outcomes that are like nearly unbelievable. So like 80 to 90% of Mindbloom clients have a clinically effective response, whereas your average SSRI like Prozac, only 40 to 47% of people have a clinically effective response. And Mindbloom works with ketamine therapy immediately, doesn't have the side effects that SSRIs do. So that's sort of the origin of how, we migrated from a vision to do at-home remote treatment that could help increase access and get people better outcomes to, doing it.
Right. Yeah, no, that's great. And you mentioned the you talked about the clinical outcomes being sort of unbelievable. And you quickly mentioned earlier also that you guys are it sounded like participating, if not leading, a clinical trial that's like one of the bigger ones that's been done in the space. To the extent that you can share, would love to hear a little bit more about that. And then sort of two-part question here to sort of round things up. I understand that like MDMA, which you've mentioned a couple times, I think was most impactful for you, and is one of those that's not quite where ketamine is, but is also going through clinical trials. Would love to hear sort of your hopes for that in the future, generally, or as it relates to Mindbloom, to the future of your roadmap for your company.
One of the things that surprised me as I really dug into the mental health care space is that my situation with my mother like wasn't that unique. The fact that we had tried a bunch of things for her, depression, addiction, and then eventually schizophrenia when it progressed to that, and that they didn't work is more like par for the course. And so 40 million Americans, one eight, as I said earlier, are prescribed SSRIs. And you've got about 30 million Americans on anti-anxiety meds like Xanax. When you dig into the research around SSRIs, you get this really bleak picture. So about any given antidepressant will work for 40 to 47% of people. 30 to 40% of people are completely treatment resistant. So they'll try like 5 to 10 antidepressants this year. None of them will work. Antidepressants take like 6 to 8 weeks just to find out if they work. And in that time, you're obviously not getting the benefits, and you're have all this uncertainty about whether or not it's even going to work for you. And for a lot of people, there's this massive side effect profile: weight gain, insomnia, sexual dysfunction that can be really, really debilitating. Oftentimes or sometimes even worse than the original symptoms of depression. With ketamine therapy, clinical studies show that if you give someone an infusion of ketamine, so like an IV infusion, and like a hospital room, so no therapeutic intervention, no preparation, no help navigating the experience, no integration, no therapy, just a shot of the medicine, it will have a clinically effective result 65 to 70% of the time, immediately, with a near zero, very much lower side effect profile. At Mindbloom, by combining the at-home therapy with psychiatric mental health care practitioners who are doing the prescribing, not just ER doctors or primary care physicians, paired with a psychedelic guide and coach who are helping people prepare, get the most out, and integrate the experiences, and a therapeutic program. We ship people a Bloom box in the mail with things like eye shade, journal, program materials. We have an application that people use that's like Headspace for psychedelic therapy with content. With all of that wrapped around the ketamine therapy experience, we're getting people a clinically effective result 80 to 90% of the time. And so we're taking a lot of what we've learned and running a study to publish, these outcomes to show that at-home ketamine therapy with this therapeutic container can have these, life-changing outcomes for such a high percentage of people. And that's, obviously good for Mindbloom, good for our clients, but it's also us doing our part to build in public and to help further the space by showing, that there is real clinical data at a large sort of number of participant level around the efficacy and safety of these treatments.
Yep. And then so the second part back there was on these other psychedelics like MDMA and I don't even know how to pronounce the other one, to be honest. I'm not going to try, but psilocybin, is that correct?
Yeah. Yeah.
Psilocybin, yeah. So for these other sort of psychedelics that are not quite as they're not quite as far as ketamine in terms of like their legality, and like you can't get them shipped to your doorstep legally as far as I understand yet, but they're in clinical trials. What's your sort of, if we could close things out with sort of your vision of the future for psychedelics at large, high strokes, how do you think the next 5 or 10 years are going to unfold, Mindbloom and just in general in the psychedelic space?
Yeah, that's a great question, Jake. I mean, at Mindbloom, we've grown from 10 people to 100 people in the Mindbloomiverse of people building, the platform, the software, the content, and treating people as clinicians and guides over the last 12 months. But it's just, it's not even day one of psychedelic medicine in terms of actually getting it to a massive amount of people who need it, and creating the transformation in the mental health care and just the mental well-being space that we really need. So MDMA is in the last phase of clinical trials and looks like it could be FDA approved in early 2023 is the target, and psilocybin assisted therapy a couple years after that. What I foresee is over the next 5 years, we're going to see psychedelic medicines, so ketamine and eventually MDMA and psilocybin, completely supplant SSRIs and anti-anxiety meds as the predominant mental health and well-being treatment. So it'll take a little while, but when you see outcomes that are this much better without the side effects, in a way that people come out of it feeling uplifted and transformed, I think the truth is going to get out a lot faster than people think. Just how, I thought that there was an underlying truth here around the therapeutic value of psychedelics before I knew that other people knew about the therapeutic value of psychedelics. And that truth has gotten out, into the world a lot faster than I could have ever imagined. 10 years from now, I foresee these medicines not just being used for, serious mental health and well-being issues and mood disorders that are diagnosable, but being used like we use, any sort of personal growth or development product. Even talk therapy, which I think we're getting past thinking of talk therapy just as for people who have issues, and also now for people who are being proactive about their health. But even that has a long way to go towards people feeling like working on their mental health and well-being is just like working on, improving their craft at work or, improving their health at the gym. We're undergoing this transition from old medicine that's reactive and disease oriented, and let's wait until you have diabetes to figure out how to give you, insulin, to new medicine that's proactive. It's about helping you live your fullest life and be your best self for yourself and others. And that's, I think, where we're going to see psychedelics head to, where we won't just help heal people who have these issues a lot faster. We'll get out in front of them and help make people really healthy so they never have, these long-term mood disorders that we see today.
Yeah, I certainly hope that medicine and health in general trends in a more proactive, preventative direction versus where it is now. And I'm sort of optimistic that with like all the different wearables and just the different sort of diagnostics we'll be able to have in the years to come, that from psychedelics to things you mentioned, like, not waiting for people to get diabetes, but helping them manage their metabolic health prior to that. I'm hopeful that a lot of this will unfold, and it's great to see that on this potentially huge sort of dimension of all of it, you are taking the lead and trying to make it more of a reality. Where can people go? Well, first of all, thank you so much for, taking the time today. It was great talking with you. I want to wrap things up here because I know we're coming up on time. But where can people go to keep up with what you're doing and follow your journey, follow Mindbloom, and if they're interested, learn more? Hopefully this can, is helpful to at least one person out there, and that would be very much well worth the time.
Yeah. If you're interested in learning more about ketamine therapy or psychedelic therapy, or working with Mindbloom on your own mental health and well-being journey, mindbloom.com is a fantastic place with resources. And if you're interested, if you're mission obsessed with psychedelic medicine, like me and everybody else in Mindbloom, and interested in working in psychedelic medicine and bringing this change out into the world, we would love to hear from you as well.
Awesome. Well, thank you very much again, Dylan. It was great talking with you.
Likewise, Jake. This was a blast. Thank you for having me on.